Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T U-verse on Channel 99. I'm Dr. David Balle, and I'm your host for In a Heartbeat. In a recent segment of In a Heartbeat, I interviewed Dr. Cheryl Wiesen. We had an informative and valuable discussion on breast cancer and breast cancer awareness. Well, I'm very happy to bring to you today the wonderful and touching story of a breast cancer survivor. It's a story of how she used an awful event in her life and turned it into a positive experience that had a wonderful, beneficial impact to others in need. It's a story I'm sure that you will want to hear, and one that is truly touching. I'd like to introduce you to Carolyn Ireland. Carolyn, welcome to In a Heartbeat.
Oh, thank you for having me.
Carolyn, I'd like to start out for our viewers, if you could tell us a little bit about yourself.
Sure.
You're a wife, a mother, a nurse, a recent nurse.
Yeah, later in life. That was my passion and calling years ago in school in 1980, and then I went on with life. I decided to, I wasn't ready for the challenges of taking care of people. I didn't have enough life experiences. So I became, first a marketing major, and I was in advertising, and I did that, and I raised kids. After that, I stayed home, a homemaker. And as the kids grew up, I decided to go back into my passion because I had life experiences. I had a lot. And I knew what I was always passionate about. So just before nursing school started, I got diagnosed with ductal carcinoma. I had a scare actually about 7 years previously to that, and it was lobular carcinoma in situ on one side. So the breast cancer does not favor either side.
Maybe we could just step back a moment, if you don't mind, Carolyn.
Sure.
Take us back to that moment, or that time where you were told something was wrong. Can you share that with us?
Yeah. Well, it's, they always tell you to do self-exams, and I never did. And I was one of those ones where, that's for other people or whatever. But for some reason, I decided to start that, and I found it in a lump in my right side, actually.
So you discovered that yourself. Mm-hmm. You must have been terrified.
Yeah, it was very scary. It was very scary, and I go, it was clearly significant, and so I made the appointment, and got it. And the first that was in 2001, and even my doctor thought it was going to be a benign something, she called it, I don't remember, but removed it and then biopsied, and then it was the lobular carcinoma, and that started me on the path to really changing my lifestyle. I was always very conscientious about exercise and diet, but I really focused on what I was putting in my mouth and really trying to do all the right things that everyone hopes to do. But then it came back. So my feelings about that is really scary, because you're just doing your life, and you think you're doing everything right.
How did you cope with that, or what did you do to allow you to move on?
Well, my faith in God is huge. If I didn't have Him in my life, I would not be so successful. And I take each day that I have, and I try to now give back as much as I can. It's strength in Him. It's support of my family and friends, and knowing that, this is all for a reason. And that's how I look at life. Everything that comes upon me or anybody else is for a reason and a path that we need to follow, and that's the journey I'm on.
And at the time that this happened to you, you were also thinking of going back to school to
Correct.
train to become a nurse.
Correct. And so I got re-diagnosed with ductal carcinoma a month before nursing school started.
Wow.
Yeah. So basically called the school and said, I got to get some things done here. and I will be back. Please let me into the next program. And obviously they said yes, and that was through Oakland University's accelerated nursing program. So, yeah.
And I'm sure at the time that you went through nursing school at that time, you had a very much of a heightened appreciation and awareness of what it's like to take care of other people who need you.
Oh, yeah. Yeah.
And maybe, who knows, maybe it was more meant to be that you went through nursing school at that time.
Yeah, it's very significant. So I'm on the floor of St. John now.
And what floor are you on?
Oncology.
Oncology.
Yeah. I started out in the orthopedics, neurology area, and then I went to, I got a call to come down to oncology because I had precepted there at school at Oakland University, and so there was room, and I said, I'll take it.
What were some of the steps that you went through in your treatment path for your breast cancer?
Well, I had a bilateral mastectomy. I was very, very lucky to have caught this early enough to not have chemo or radiation. And I am very, blessed to be able to just move on from this and give back to all the people who have it and continue to have it and suffer through it. The mastectomy decision, there was a thought of a lumpectomy, but it really, for me, there was too much of it. Most of the breast would have been gone anyway, and then there was the other side had hyperplasia cells, developing. So that's when I decided to remove them both and get reconstruction done.
For a woman who may be facing some of these issues at this time and having gone through it yourself, you have a special insight. Is there any thoughts or advice you'd like to pass on?
Wow. Honestly, because you never know what each day brings. You never know what's going to happen. Like I said, you just go and do your life, and this happens all the time on the oncology floor. These patients in there, and I'm looking at them, and they said, "Wow, I just went to the doctor, and they found something unusual." And that's about how a lot of the stories start. So advice is
usually a shock and a surprise.
It is. It's a very big shock. So the advice is live your life to the fullest each day. This is the day we have.
And that's great advice for everybody.
And but start thinking about making better choices. I have to say that you have to start thinking about, putting exercise and proper eating into your lifestyle, because those are the things we're trying to figure out. Is it environment? Is it genetics? It's a combination of things, and no one really knows for sure, but we can come to some conclusions.
During this process, I think you had some moments of insight and inspiration about, what you could do through your own experiences to help other people as you went through this process and this system of being a patient. And what happened with all that?
Well, this is actually so significant to me that when I'm going through the reconstruction, or when I lost my breast, I remember sitting home going, "Wow, where there's counseling, but I'm a personal trainer, or I'm now, if I can mention this now, I'm certified in cancer exercise therapy, and I'll explain more about. I have many who are now out there. So I decided I wanted to give back to the community, to all the people who have cancer. Breast cancer is so significant. It's popping up everywhere. You don't even have to do the research. I get calls. In 6 months, I got 3 calls from 3 different friends saying, "Guess what I got?" It's every other person is almost getting it. It's like an epidemic to me. And I noticed that right at that time that how do I walk back? It's the support system in the community needs to be more forceful and more action oriented. We need more develop stronger wellness programs, stronger prevention programs, And that is directly why when walking into the gym going, what do I wear? People know me. I don't know what to even put on. It's not the same me anymore. I'm a very confident person, but to those people who are not, they don't have, and if you have loss of hair, you have low self-esteem, anxiety, weight gain through hormonal therapy, everything, they just feel depressed. So where is that place of recovery? Where is that great place? So I started a foundation called Pink Blessings Cancer Foundation.
And Carolyn, tell us, what is Pink Blessings? Well,
Pink Blessings is a foundation that is directly aimed, the mission is to help all the women in need who have breast cancer patients and survivors, that we can help them, take them by their hand and say there's another step. So it is basically an overall wellness program package for these wonderful women and men, unfortunately too now, that is rising, that will take them in and show them how to exercise, proper eating, proper nutrition, and the support systems that we have, even more mental therapy with art therapy in development, as well as knitting therapy and massage, and of course.
And this is relatively a recent project. It isn't that, it hasn't been around that long. When was it started?
2000. Actually, during my process with my cancer, 2008. I thought about it. I'd say 2010 is actually when I got a 501c3.
The things that you mentioned offhand sound like wonderful things that many people may have assumed or thought were already in place. But were they?
No, not directly. There's physical therapy. Physical therapy but it's 6 weeks, and you can, take advantage of that. It's really important. But it's that extra beyond, getting people back into the community again, making them feel integrated again. What I'm doing is it's a step down area, taking the medical with the community and taking personal trainers at that level, so that you can continue at a lower cost, really, and providing hopefully free for most people who are in need.
And it's really helping to nurture the recovery of somebody beyond just the physical aspects of that, isn't it?
Oh yeah, absolutely. It's so much more. It's motivating people. It's taking their hands. And actually, it's stated on my website that I have. It's pinkblessings.org. It says you will never be alone, and that is what this is all about. You can after treatment, and after the doctors say I don't need to see you anymore, it's a very scary place for that person sitting at home.
You're kind of off on your own, and although people may have family members, spouses, children, in many respects, they all have things that they have to do in lives of their own. That support system isn't always there like you would think it might be. Is that true?
Yeah, very much so. Yeah, it isn't. It's being with people who have gone through it is the most significant. People who've actually been there, done that.
So I'm going to ask you a couple questions. Do you have an official mission statement for Pink Blessings?
It's helping. It is stated on the website, but it's helping breast cancer survivors to recover after invasive treatment through exercise, through diet, and a complete wellness package for this. Hopefully for the Southeast area. It's small right now. With support in the community, we will grow tremendously, and I want to thank you right now for the tremendous support you've given me so far for my first event, Drive for the Cure, and as even today, helping with our patients. We have 6 now, pilot patients that we're helping, and you're going to be helping with some skincare treatments for them, so I really thank you.
It's my pleasure. It's a great need, and I'm happy to do it.
Thank you.
Maybe you can go through with us again, although you mentioned some of it. What are the different services that Pink Blessings Foundation provides for those in need?
Specifically, number one is, and probably top priority, is the exercise. And so we have 15 now certified cancer exercise specialists.
Really? And were there people like that before, or is that a relatively new thing? I hadn't heard about it.
It is newer. They're discovering the research is profound on the need for exercise in the community.
And what does that do?
With cancer patients, I should say directly. During chemo and after chemo, it lifts the nausea is actually a little reduced. There's clinical evidence for that. Your fatigue is reduced. Your depression, anxiety is reduced through increasing your endorphins, through exercise, stimulating and circulating the blood system and the blood supply to get oxygen all over your body. It's a complete win-win-win, basically, for everyone, and they do feel better. It feels like you're having control over the disease too while you're. And that's what it is. It's a loss of control.
There's a loss of control that that probably is hard to really put a finger on in terms of what that means in a person's life.
Oh, absolutely.
And this is part of gaining that back.
Yes. Oh, very much so. It is. It's empowering women.
And what sort of exercises are involved in this?
Mostly range of motion. It's right at the physical therapy level coming out, and as they get better, they will be able to be more strength training will be, put into the program. In the very beginning, it is range of motion exercises. There's postural imbalances through. If you take the abdominal tram to reconstruct the breast, you have now your back is curved. You're going to have back pain. If you have a latissimus dorsi flap, which isn't as common now, but that's done. That also causes rounded shoulder. Women will go this way. We want, and that's where all the postural imbalances and pain comes from. So it is first alignment and corrective exercises, and then strength training comes right after that. And you can get someone completely back in alignment and strengthening their back, their pectoral muscles. And also with contractures, which is common, we can help prevent that too through strength training, keeping the muscles supple. You got to move it, and that'll keep them, within their expanders. And
where is this exercise training done? Is it done any place in particular?
Right now, currently, it's anywhere just about in the community that you want. The trainers are from the different clubs. I have Point Fitness and Training. On Harper I have 3 trainers there. I have East Side, and they're just wherever. We can go into the home. I have Next Level, and I have Grosse Pointe Athletic Club. So there's sources, and they're there. So I will connect you. If you get in contact with Pink Blessings, I will put you directly with the right person.
And tell me about the knitting. What does this do for a patient who's gone through treatment, and why is that important?
Knitting is a really wonderful therapy. It's your mind. It's your mind that is thinking, and it's that finite movement, and takes your mind off of your disease. And it's really sitting with women who have all been there. It is its own counseling session right there, and therapy in itself. And they just exchanging thoughts, and while you're knitting, it's just a release and a relaxation technique, really.
Do they need anything in particular? Or is it for themselves, for somebody else, or?
No, not at all. It's just they just come and they learn to knit.
And where is that done?
And that's in progress right now. There's some things that are not ready yet. I have I'm looking for the place for that right now, and that's significant. But I have the trainer. Her name's Monica Zabo.
Great. Well, maybe one of our viewers can help you find that place.
Yeah, that would be wonderful.
And tell us about some of the other aspects
and
of
art therapy. I'm not going to mention Pat Fawcett too.
Yes.
Same thing. Once we establish that location, we can provide some of these services.
And tell me what you have planned for the art therapy.
Well, we're going to have, Pat Posset will provide, and Pink Blessings, the tools, and we may ask the patients to have a couple, bring a couple things themselves, but just simple things, just painting, it could be color or oil or something, and anything that Pat Posset or the patient would like to do, basically. It's very simple.
And how may others get involved if they are inspired by your program and want to be a part of that? To get in contact with Pink Blessings is really the key, and I have a phone number and a website right now, and the website is pinkblessings.org, and the phone number, it's posted, I know, on your show, but it's 770-3345. And how does Pink Blessings raise money?
Through right now directly all fundraising. It's different events in the community.
Tell us about the first event you had.
The one I'm coming up with a couple more this spring, but one that connected fairly quickly was on May 11th at Spa Renaissance. It's plastic surgery is going to host with two other charitable foundations, which I don't know their names actually, or I would announce it. On May 11th, they're going to have a casino night to help raise money for Pink Blessings.
That sounds like fun.
Yeah, it should be a lot of fun. I'm looking forward to it very much.
And I think in the fall you had an event where you had an opera singer.
Yes, that was very fun. And of course, that was my niece who came from Cincinnati. She had a full ride at the University of Cincinnati, and she's a great singer. She's professional now. And she came up and sang for us at Andiamo's on Mac, Andiamo Trattoria on Mac, Trattoria. And it was a great event and very successful. We filled the whole place up, and it was just such a successful night of people having a good time while they're raising money for a really great cause. They're getting it. They're seeing the need now, and that's the biggest part, is getting everyone to understand what more we can do.
And the time before that, you had a road rally.
Yeah, that was fun. Drive for the Cure. That was probably a really difficult one. That was my first event. And
what made you think of that?
Anything I do is going to have a lot of fun with it, or I don't. It's not worth it to me. So we better have fun while we're raising money for our breast cancer survivors. I always wanted to do a road rally. I used to do them when I was younger, and my parents would always take me on some of them, and it was just wonderful. And I said, you know what a cool idea. We do these runs and walks. Let's drive. That was about it.
That sounds like it was a fun thing.
And we ended up here at the War Memorial, and had a wonderful party.
Having gone through what you've been through, and now you're on the oncology floor. I would just think that you probably have a special way of helping those people going through cancer treatment for whatever reason.
Yeah.
Have you experienced that?
Oh yes, so significantly. It's, in fact, like I said, you can use what you have, and you can use it for the positive and for the good. And so when patients say, I have breast cancer, I know walking in what they have, and it's metastasized. Often on my floor, it's more advanced, unfortunately. But I look at them and I hold their hand and I sit with them and I say, I've had it too. And I said, I give them some encouragement and some ways of coping. And it's basically humanness. It's really just. It's just holding someone's hand. It's saying you can do this, and you're not alone, and you're gonna get through this, okay? And that's basically, it's just a day-by-day process.
And I think you touched upon something that's very important. I think sometimes when people face something very difficult and they have an important challenge ahead of them, we as their friends or support or family, we wonder what can we do, feeling almost powerless as the patient sometimes can. And sometimes just being present for them is what they need, isn't it?
Yes. Oh, just, it is. It's just listening sometimes, just sitting there, letting them tell their story. And that is so significant. Nursing is so fast-paced. Everything, we have to do. Even the doctors are overworked. And if we could just take the time and just find it and say, you know what, I'm going to put off the charting for a little bit and just sit. And that charting will have to be done later, because that is the most significant healing process ever. The patients will say, thank you so much. And that's what they need more than their Lovenox shot that day.
I believe it. And you also mentioned, so that people know, men can get breast cancer as well.
Yes.
Have you ever run across a situation?
I have. 2 now so far, and I've been on the floor a year and a half. So I think 2 men in a year and a half is significant right now.
It seems like a lot.
Mm-hmm.
Seems like a lot.
Yeah. So.
Are there any other thoughts that you'd like to share before we close?
Just, oh my gosh, there's so much. I just hope that the whole community understands the need to help out with supporting the continued health prevention, disease prevention, and health promotion of our cancer patients. And really, this program really reflects all cancer patients. Maybe someday this will get big enough to expand into that. So I hope everyone sees the need to help with changing our lifestyle and letting us heal. We need to heal. And that's what we need, holding hands and helping us get better with exercise and diet and wellness programs. And
I think this is a wonderful start and a wonderful beginning, and who knows where blessings may go. Well, Carolyn, thank you so much for being a guest and sharing your personal experiences and your personal triumphs, and I wish you all the success.
Thank you very much for having me.
And thank you to our viewing audience as well. As always, we appreciate that you tune in to watch our show. Take good care of yourself and those around you. Thanks for tuning in. We'll see you next time.